Hey everyone, welcome back to the Postpartum Nurses. I'm Gabby.
And I'm Felicia. We're postpartum nurses who've cared for hundreds of moms and babies. And today we're breaking down what's normal to see in your newborn skin, diaper changes, and those first shots and medications right after birth.
Newborn skin can look a little surprising at first. It's going through a big transition from life inside the womb to life outside, and that comes with a few totally normal changes.
One of the first things you might notice is some peeling skin, especially on the hands and their feet. That's just your baby shedding old layers from being in fluid for 9 months.
You might also see some Vernix, that white creamy coating that protected your baby's skin before birth. It's actually a natural moisturizer, so don't feel like you need to wipe it off right away. You can actually gently rub it into the baby's skin if you want to.
And here's something a lot of parents notice. Your baby might have fine, soft hair on their shoulders, their back, or even their face. That's called Lanugo.
Yep, Lanugo forms in the womb to help protect your baby's skin. It's more common in babies born a little early, but even full-term babies can have it. It usually falls off in the first weeks after birth.
You might also see tiny white bumps or baby acne like milia or erythromycin. That's what the medical terms for them. But you'll see like these little white bumps and then like also maybe some baby acne. Again, it's totally harmless. It'll go away on its own.
And if your baby's skin looks a little yellow, that could be jaundice, which happens when the liver is still learning to break down that bilirubin. It's common, and your nurse or pediatrician will monitor it closely.
The best way to actually get rid of bilirubin is the baby has to poop it out. So make sure your baby's feeding really well. And sometimes parents get really worried when they see a small amount of blood in their baby girl's diaper, but that's actually called a pseudo period, completely normal.
Exactly. It's caused by mom's hormones still circulating through the baby's system, and it usually lasts only a day or two.
And if you notice a rust-colored or pink stain in the baby's diaper, that's also totally normal. They're urine crystals, also known as brick dust.
So that uric acid crystals, again, which is normal, it happens in the first few days as your baby adjusts to feeding. Once your baby starts feeding more frequently, it should go away.
So now let's talk about medications and vaccines your baby receives shortly after birth. That includes vitamin K, erythromycin eye ointment, and the hepatitis B vaccine. And we just want to let parents know, since it's important on our end that we want you to advocate on your behalf, we will provide you with this information so you can either consent or you actually can also refuse.
So first up, vitamin K. Babies are born with low levels of vitamin K, which helps the blood clot. Without it, they're at risk for vitamin K deficiency bleeding.
That's why your baby gets a small injection in the thigh soon after birth. It helps protect them from any bleeding issues until their body can make enough on its own.
Next is the erythromycin eye ointment. It's a thin layer of antibiotic ointment applied to each eye to help prevent infections from bacteria that can pass during birth.
And your baby's eyes might look shiny or a little sticky afterwards. That's totally normal. It'll clear up. Try not to rub it off.
And finally, that hepatitis B vaccine, the first of a series that protects your babies from hepatitis B, which is a virus that affects the liver. The first dose is usually given before you go home from the hospital.
And all of this information will be discussed with your pediatrician, so you can either sign consent or you can also refuse, but make sure you ask questions along the way so you can make that best informed decision. We know those first few days can be filled with surprises, from fuzzy shoulders, peeling skin, diaper stains, and the first shots. But most of these things are completely normal.
Exactly. Always ask your nurse or pediatrician if something seems off or if you're unsure. That's what we're here for.
And if this video helped you, give it a thumbs up, subscribe, and share it with a new parent who might need some reassurance.
And follow us on Instagram at the Postpartum Nurses for quick, evidence-based postpartum and newborn tips.
See you next time.